Hello, everyone, and a warm welcome. In this video presentation, I will be exploring essential multiple choice questions, MCQs, with brief explanations from Unit 2 in addition to the MCQs already uploaded in anxiety disorders, panic disorder, and post-traumatic stress disorder. Dear viewers, if you want to practice these MCQs, turn off the volume of your mobile phone during the first round. Then, in the second round, turn on the volume to check your answers. For MCQs on other topics, don't forget to subscribe to my YouTube channel. Let's attempt to solve some important MCQs one by one with a brief explanation. Question 1. What is panic disorder? A. Fear of specific objects or situations. B. Chronic worry about various aspects of life. C. Recurrent and unexpected panic attacks. D. Excessive fear of social judgment. The correct answer to question 1 is option C. Recurrent and unexpected panic attacks. Explanation: Panic disorder is characterized by recurrent and unexpected panic attacks. Question 2. Panic attacks typically involve A. A gradual increase in anxiety. B. A sudden surge of intense fear or discomfort. C. Chronic muscle tension and restlessness. D. Fear of specific objects or situations. The correct answer to question 2 is option B. A sudden surge of intense fear or discomfort. Explanation: Panic attacks involve a sudden and overwhelming surge of intense fear or discomfort. Question 3. During a panic attack, individuals may experience A. Excessive worry about various life situations. B. Chronic headaches and muscle tension. C. Shortness of breath, palpitations, and chest pain. D. Aversion to social gatherings. The correct answer to question 3 is option C. Shortness of breath, palpitations, and chest pain. Explanation: Physical symptoms of panic attacks may include shortness of breath, palpitations, and chest pain. Question 4. Panic disorder often coexists with A. Obsessive-compulsive disorder, OCD. B. Social anxiety disorder. C. Generalized anxiety disorder, GAD. D. Bipolar disorder. The correct answer to question 4 is option C. Generalized anxiety disorder, GAD. Explanation: Panic disorder commonly coexists with other anxiety disorders, including generalized anxiety disorder, GAD. Question 5. Which neurotransmitter is often implicated in the development of panic disorder? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Endorphin. The correct answer to question 5 is option B. Serotonin. Explanation: Imbalances in serotonin levels are associated with the development of panic disorder. Question 6. Panic disorder is diagnosed when an individual experiences A. One panic attack. B. Recurrent panic attacks followed by persistent worry about having more attacks. C. Chronic worry without panic attacks. D. Fear of specific objects or situations. The correct answer to question 6 is option B. Recurrent panic attacks followed by persistent worry about having more attacks. Explanation: Diagnosis of panic disorder involves recurrent panic attacks and persistent worry about having more attacks. Question 7. Benzodiazepines are a class of medications sometimes prescribed for panic disorder. What is their primary effect? A. Increasing serotonin levels in the brain. B. Reducing muscle tension and promoting relaxation. C. Enhancing cognitive functioning. D. Blocking the reuptake of dopamine. The correct answer to question 7 is option B. Reducing muscle tension and promoting relaxation. Explanation: Benzodiazepines have a calming effect, reducing muscle tension and promoting relaxation. Question 8. Which of the following is a common cognitive distortion in panic disorder? A. Catastrophic thinking. B. Compulsive behaviors. C. Chronic worry about various aspects of life. D. Fear of specific objects or situations. The correct answer to question 8 is option A. Catastrophic thinking. Explanation: catastrophic thinking involves anticipating and fearing the worst case scenarios, often seen in panic disorder. Question 9. Panic disorder is more common in A. Children and adolescents. B. Young adults. C. Middle-aged adults. D. Older adults. The correct answer to question 9 is option B. Young adults. Explanation: panic disorder often emerges in late adolescence or early adulthood. Question 10. Mindfulness-based approaches, such as mindfulness meditation, may be beneficial in managing panic disorder by A. Suppressing anxious thoughts. B. Increasing avoidance behaviors. C. Cultivating present moment awareness without judgment. D. Inducing panic attacks. The correct answer to question 10 is option C. Cultivating present moment awareness without judgment. Explanation: mindfulness-based approaches aim to cultivate present moment awareness without judgment, providing a non-reactive perspective on thoughts and emotions. Question 11. What is post-traumatic stress disorder, PTSD? A. Fear of specific objects or situations. B. Chronic worry about various aspects of life. C. A psychological disorder that can develop after exposure to a traumatic event. D. Excessive fear of social judgment. The correct answer to question 11 is option C. A psychological disorder that can develop after exposure to a traumatic event. Explanation: PTSD is a psychological disorder that can develop after experiencing or witnessing a traumatic event. Question 12. PTSD is often associated with A. Chronic muscle tension and restlessness. B. Recurrent and unexpected panic attacks. C. Intrusive thoughts, nightmares, and flashbacks. D. Excessive worry about future events. The correct answer to question 12 is option C. Intrusive thoughts, nightmares, and flashbacks. Explanation: common symptoms of PTSD include intrusive thoughts, nightmares, and flashbacks related to the traumatic event. Question 13. PTSD can develop after exposure to various traumatic events, such as A. Public speaking. B. Natural disasters, accidents, or combat. C. Routine medical procedures. D. Daily stressors at work. The correct answer to question 13 is option B. Natural disasters, accidents, or combat. Explanation: PTSD can develop after exposure to various traumatic events, including natural disasters, accidents, or combat. Question 14. Avoidance behaviors, a common symptom of PTSD, may involve A. Engaging in risky behaviors. B. Avoiding reminders of the traumatic event. C. Experiencing chronic headaches and muscle tension. D. Fear of open spaces or public places. The correct answer to question 14 is option B. Avoiding reminders of the traumatic event. Explanation: avoidance behaviors in PTSD may include avoiding reminders of the traumatic event to cope with distress. Question 15. Hyperarousal, another symptom of PTSD, may manifest as A. Chronic muscle tension and restlessness. B. Numbness or emotional detachment. C. Avoidance of social situations. D. Panic attacks triggered by specific stimuli. The correct answer to question 15 is option A. Chronic muscle tension and restlessness. Explanation: hyperarousal in PTSD may manifest as chronic muscle tension, restlessness, and an increased startle response. Question 16. Trauma-focused cognitive behavioral therapy, CBT, is a common approach for treating PTSD. What does it involve? A. Identifying and challenging maladaptive thought patterns related to the trauma. B. Medication management to reduce anxiety. C. Exposure to feared situations to desensitize anxiety. D. Relaxation techniques to manage physical symptoms. The correct answer to question 16 is option A. Identifying and challenging maladaptive thought patterns related to the trauma. Explanation: trauma-focused CBT involves identifying and challenging maladaptive thought patterns related to the traumatic event. Question 17. Dissociation. A common experience in individuals with PTSD may involve A. Excessive worry about future events. B. A feeling of being disconnected from oneself or the surroundings. C. Panic attacks with physical symptoms. D. Fear of social judgment. The correct answer to question 17 is option B. A feeling of being disconnected from oneself or the surroundings. Explanation: dissociation in PTSD may involve a feeling of being disconnected from oneself or the surroundings, as if observing from a distance. Question 18. PTSD is more likely to develop when the traumatic event A. is anticipated and expected. B. Involves intentional harm by others. C. Occurs during adulthood. D. Is a routine part of daily life. The correct answer to question 18 is option B. Involves intentional harm by others. Explanation: PTSD is more likely to develop when the traumatic event involves intentional harm by others. Thank you everyone. Don't forget to subscribe to my YouTube channel Education and Teacher Education at Shoki Bilal.